Hello and welcome to Spotlight On. I'm your host, Jeff Merritt. Heroin and opioid painkillers are cutting life short for Americans who live in rural and suburban communities. Commonwealth's Attorney Thomas Bowers, who chairs the Heroine Task Force, Roanoke Valley, is here to talk to us a little bit about the opioid epidemic. Thomas, thanks for coming in. I really appreciate you.
Thank you for having us.
So let's start off with a little bit of the history. How did we get here? When did all of this get started?
Well, this is actually a problem we created. Back in the 80s and early 90s, there was a demand for more pain medication, and patients demanded more pain medications. The medical community responded, and so did the prescription manufacturers. And so what happened is, people probably didn't know that there was this addictive medication, but we have an increase in medication. It's the medical community, the whole culture of what we were doing changed. And so the goal is, at some point, we've got to change it again. Right. But we created our own problem by our demands, a supply and demand of needing more pain medication. Pain medication was given, and now we know it's addictive and it causes death and leads to heroin use and causing death.
And obviously it's a perpetuating problem because while it may start innocently with the painkillers, it can lead to certain additional activities that may not be prescribed by physicians, et cetera.
Well, it does. It's changed from the traditional route of someone getting into drugs, and so many people we're dealing with had teeth pulled or knee surgery or had a car wreck, and then they got hooked on these medications. And then at some point the doctor said, okay, you've been on them too long, you have to come off them, or they couldn't afford the medications. Right. And the heroin dealers gave a cheaper product. And so the typical supply and demand marketing mentality, right, unfortunately.
Now there's a heroin opioid prevention task force. What can you tell us about that?
That started about 5 years ago, I guess, we have a law enforcement summit where Roanoke Valley law enforcement meet once a month. And it's chiefs and sheriffs and Commonwealths attorneys and probation officers and prevention specialists. And so we were meeting enough to where we said we got to create this. We actually created it in response to when we had bath salts here 4 or 5 years ago, which kind of came and went. And then when we realized that we had this growing heroin and overdose problem, we were somewhat formed and ready to deal with it, and that's grown out of that task force.
Now obviously this is one way, but how else are you getting the word out about it, and how many people have you been able to reach so far? Okay.
We're getting the word out by we're offering to go into schools, churches. We just met today with Jefferson College of Health Sciences, some nursing students, and we've got to get the word out about the culture change, the change in culture in the medical community, the change in culture in our own way of looking at things, of knowing what is in our medicine cabinet, of getting rid of old medicines, of understanding that addiction is not equal to a crime. It is a disease, and we've got to deal with it like a disease. There's some crime related to that, but we've got to look at it differently. Last year we spoke to every single high school student in the Roanoke Valley. We've done forums, we've gone into churches, we're going into another church tomorrow night. We will go anywhere we can to try to give this information to help change this culture, because that's what it's going to take. It's going to take a culture change to beat this problem.
So in the last 30 seconds or so, can you tell us a little bit about how somebody could get involved if they want to help out?
Call me, call the Prevention Council, call RASAC, call and ask for help, because this is it's a problem of ignorance in that people just don't know the problem that we have. And we've created it. It's going to take us to get out of it. But call and ask for help. Go through your church, your school. I guarantee most people have somebody who's affected by this. Call and ask for help. There's ways to help it, but we can't hide behind the problem anymore.
Gotcha. Tom, thanks so much for the information. Hang out with me. When we come back, we will talk a little bit more about possible solutions for this problem. Welcome back to Spotlight On. Today we're discussing the opioid epidemic, and joining Thomas Bowers on the set now is Nancy Hands, Executive Director of the Prevention Council of Roanoke County. Nancy, thanks for joining us today.
Thank you for having me.
So tell us a little bit about the council's mission and how you all became aligned with the task force.
Okay. So our mission is to promote the healthy development of youth, but it's also to support families, support parents with resources and education. And we came to the table, law enforcement asked community nonprofits and community groups to come to the table really back in 2012 with the bath salts. And so that was how we then started to become a line and a partner with the opioid task force.
Gotcha. Now, what does prevention really look like when we talk about prescription drugs, et cetera?
So, believe it or not, there are even middle schoolers that are getting into medicine cabinet because of what they would see possibly even on TV or amongst their peers as stress. And we know now that as young as elementary school kids are having use of phones, and that causes all kinds of anxiety sometimes when there's too many apps that they get on. But when they go into middle school, we know that 11, 12, and 13-year-olds are getting into that medicine cabinet and using prescription drugs. And that's what we want to do, is we want to really start at the earliest possible age with them, but also their family and their parents, because we really need to educate parents on how this risk factor can really draw a straight line to very high risk behavior.
Right, the entire family
Yes.
prevention, in other words. And so we've heard, it's been said that we're losing a generation of youth. What does that mean?
Well, that means that now that we've seen what's happened, and we really didn't know what was happening, it was almost a perfect storm with the pills, that even here in this valley, we have, between just a couple of high schools, we have lost somewhere between 25 and 30 graduates of these high schools. And we have even more that are trying very hard to stay in recovery, but there are also those that are desperately continuing to struggle with the disease of addiction. And it's spanning over 10 years, because this is a group of our young adults that are in their 20s that we're losing because of this addiction.
Right, right. Tom, how do we change the face of addiction and the stigma associated with it?
Well, we've got to change a culture. We've got to change a culture of how we look at it. We need to change the culture of that if someone is an addict, they are not a criminal. Possession of a drug may be a crime, but to have an addiction is not a crime. And we've got to come out of behind our families. We've got to come out and ask for help. We've got to change the way we look at people who are addicted. We've got to change the way, we've got to make more treatment centers available, because there's just not enough treatment available. We've got to change the culture of how we deal with medicine.
Can you kind of close us out a little bit and tell us about the things that we're doing here in the Valley to help confront this?
Well, the most important thing is getting the word out and explaining the problem we have. We have to understand the problem before we come up with a solution. And so we've done that. We have the Hope Initiative here in Roanoke, which is where somebody can go and get help. And so we've got to, again, going back to the stigma word and the culture word, that we've got to change the fact, and we've got to get people out saying addiction is a disease. We've got to come out and get help. I'm not ashamed to come out and get help. And so we've got to, but we got to change the way people look at things like that.
Right.
And we've got to look at these at-risk behaviors, and we've got to look at the different ways that our families have changed. And we've got to look at, we sometimes better take a little bit of pain in ourselves.
Right.
And that medicine is not going to solve every problem we have.
Thank you very much. I appreciate you sharing a little bit more information on that, Nancy, Tom. Thank you both for joining me today. I really appreciate you coming in.
Thank you.
Thank you.
For more information about the Prevention Council of Roanoke County, you can visit their website. For Spotlight On, I'm Jeff Merritt.